Good morning, everyone. And just in case you were going through withdrawals, boo, boo. There is no better way to start this story about looking and working in the Upper West region of Ghana than with this video. Please roll the video.
Good morning, fellow Rotarians and guests of the District Conference of District 6400. My name is Dr. Godfrey Bachia. I'm a member of the Rotary Club of Windsor 1918 in Windsor. And I'd like to thank you for coming to the conference and to thank all the Rotarians and the Rotary clubs of the district who over the last 34 years, since 1994, have been instrumental and supportive of projects that have been carried out in Ghana as a whole, mainly in the North Upper West region and in the Central region. We've concentrated ourselves in the areas of education, maternal child health, water and sanitation, women empowerment and economic development. And as the impact over the last few years, I can tell you, and those members who've been to Ghana from the district, has been tremendous in all the areas in improving the quality of life, the educational system, maternal child health, and all areas that we have been involved. And again, I would like to thank you, and Linda will show you examples of the projects we've done.
This is a story about impact, but it's also a story about the power of passion, about relationships, about trust, and about sustainability. And most of all, it's a story about the impact on individuals, villages, and communities in the past, the present, and the future. But before we can talk about the future, we need to understand the past. And it began with the man you just saw, Dr. Godfrey Bachia. He started work in the Upper West region of Ghana more than 30 years ago, and it was at a time when women and girls walked for hours to carry drinkable water to their families. Schools were in disrepair, or they didn't even exist for the younger children, and many children didn't even have the opportunity to get an education. Malaria was rampant in the area with high mortality rates for younger ages. And the mortality rates for newborns was so high because there was no access to prenatal and postpartum care. This little one in this picture, she didn't make it. She died overnight. But over the years, many Rotarians and non-Rotarians have gone to Ghana, and with the help of so many Rotary clubs and Rotarians and the district and matching grants and Rotary International, there's so much work that has been done. Sometimes the projects start small, $300 to support 30 women in the village of Degri to buy hose and peanut seeds to cultivate their own farm and to share the net proceeds equally. And the impact? Well, the numbers grew to 65. And they started to produce their own rice, and they had goats, and they started a pig farm. And here you can see them getting a microloan of $5,000 that quickly doubled. And there are now 2 additional villages with similar programs. In 1998, there was a creation of an economic development project by building a workshop to provide furniture and sewing machines for women paralyzed by polio. These ladies soon started training other women with disabilities. And then more than 20 other women graduated with their own sewing business as a source of income. This was funded by a $25,000 matching grant, and here you can see Jeannie DeRoshi and Sheila Mosley helping the women. We all know that water is life, and as early as 1993, Rotarians were building water wells that produce drinkable water today. District 6400 Rotary clubs and partners have a presence in the central region in Jirapa for more than 20 years and have wells drilled in 60 villages. Incredible work. The Rotary Club of Windsor 1918 Centennial Celebration included a major water project in the town of Jirapa. They only had 4 operating wells to service and to serve 18,000 residents. But with a partnership with the WA and Accra Rotary Clubs, that partnership continues today. And still, the requests continued, even during COVID. And with money from a few of the Rotary Clubs in the district and global matching grants, Water wells were drilled in 28 more locations, including villages, healthcare centers, and schools. And the impact? Well, young girls don't need to travel for hours to get water. They can actually think about going to school. The overall health improved and the reduction in cholera and other waterborne diseases, and it reduced the number of admissions to local hospitals. There was a time when we also addressed the major, and we continue to address the major healthcare initiatives and healthcare concerns in Ghana, including vision care and eyeglasses and dental clinics, and the teams distributed mosquito nets to pregnant nursing mothers to prevent malaria, because malaria was the leading cause of death for children under 5. Infant and maternal death rates were high, so we built a brand new NICU clinic to treat premature babies. 14 incubators, and every year, anytime a Rotarian returns to Ghana, every one of those incubators is in use. When vocational training teams started, we had a vocational training team helping babies breathe in the infant CPR program. The team here that you see trained 80 workers, and also 15 additional workers were master trainers that included midwives. That, ladies and gentlemen, is sustainability. Several individual Rotarians also supported the opening of the Sisters of St. Joseph Orphanage, and this orphanage cares for children whose mothers died during childbirth or who died from one of the many diseases, life-threatening diseases that existed in the area. And you can see wonderful Dr. Bachia so at home in his homeland. Rotary also focused, as we know, on education and literacy, and here we are, building a library, using Rotary matching grants and furnishing it. And might I add, these students that you see in this picture, they are in the library on their vacation. Amazing. I know I never went in the library on my vacation. The Plymouth AM Club led the way, becoming involved in much-needed education in children in several villages. Many children were learning like this, under a tree, with no accommodations, no school, or they weren't learning at all because it was too warm, or then the rainy season would come. The village of Galpala had a school constructed. And you can see as it continues through fundraising and donations from a local Windsor couple, as well as many Rotary clubs. Many of you have supported water wells, new school lunch programs, and toilets. And in May 2019, a vocational training team trained teachers in grades 1, 2, and 3 in what's called engaging students in the classroom. As a result of the training that happened here you can see us training the teachers as well as the impact on the students. Additional trainings were conducted by circuit supervisors in Ghana. They took the training and they moved forward and did it themselves. Sustainability. They also provided, and we're also providing several scholarships for several students to become teachers and nurses. So, what about the future? Well, we're illuminating hope for the future in Ghana. Installing internet capacity and equipment to Jirapa to continue remote teacher learning. The first thing that they asked for is how to teach reading. We need to continue to teach literacy in the Upper West region. There's also reading books are being provided to children to take home. Now imagine how novel that is and how unique that is in Ghana. Books that they can take home. They've never had that before. The VTT Global Grant has been secured to conduct more training for teachers, and more training to continue to expand the work that's done. Rotarian Ron Arkell from Windsor 1918 has been appointed as the ambassador of the Wash Rag program, and he will continue to expand and to educate Rotary programs. And we're also adding toilets and hand washing facilities in villages and near healthcare facilities. And this man, This young man, I need to share a little story about this young man. I had the wonderful privilege and opportunity as a member of the Roseland Rotary to join the VTT group in May of 2019. This young man was playing a game we had developed where students use popsicle sticks. And on the popsicle sticks, there are letters and vowels. And the intent is that they're supposed to then take these popsicle sticks and make words to improve their literacy. I had the wonderful good fortune of capturing his expression as he picked up a stick and realized he just won the game. He just won. Now, the understanding and the impact was clear on this young man's face, but it also became so very clear to me. And I direct these comments to all of us, but to certainly those of us that are at a district conference for the first time. There is a saying by a poet that says, "When you are born, your work is placed in your heart." But for many of us, we have interests, we have skills, we have abilities, but we don't always know what they are. And what I encourage you to do is sometimes you just listen, and you listen very quietly, because sometimes they come to you in a whisper. And in that whisper, you will find the work that is placed in your heart, like I did. Because when you turn those whispers into action, you, like me, have the opportunity to witness a wonderful moment like this. So, the work in Upper West Ghana and Jirapa continues. And if any of your clubs are interested in supporting the work in Ghana, here's a list of contacts. You can call me too. The path has been created. The relationships have been made. The sustainability is there. And just imagine the opportunity to turn all our whispers into a collective roar. Thank you so much.